Health news you missed. Scientists from the A-Star Genome Institute of Singapore have developed a new artificial intelligence-based model called Fragile that makes tracking cancer easier and faster than using our currently available blood tests. It's also a potentially more affordable way to monitor cancer and may also help identify tiny traces of cancer left after surgery or treatment, which could help doctors detect potential relapse early. In a groundbreaking human clinical trial, a patient was operated on while they were in Africa and a doctor was in Florida. Dr. Vipul Patel has been trying to get this off the ground for a really long time. He was the one that was sat in Florida while he did a prostatectomy via robotic surgery on a patient in Africa. The success of this could help physicians learn how to do surgeries from a distance or help patients from a distance by doing surgeries on them in rural areas and in other areas of the world that just don't have access to that type of expertise. The data from this is going to be sent to the FDA in hopes that more telesurgeries will be able to be done. Next up, the story of how Novo Nordisk will lose billions because it didn't pay a couple $100. When this came across my feed, let me tell you, I was laughing the entire time I read the article. In Canada, Novo Nordisk did file a patent for Wegovy, their very expensive and very profitable weight loss drug, but they neglected to pay a $250 maintenance fee. In fact, apparently, the lawyers even asked for a refund of said fee back in 2017. So due to Novo Nordisk's mix-up, in 2026, Canadians will have access to generic versions of Ozempic and Wegovy, which is also very interesting for people in the United States because there was a law or regulation or something like that passed by the FDA that allowed Florida, for example, they were really the one that was pushing it, to be able to import medication from Canada at a lower cost. So are people from the United States going to end up gaining access to this generic? I mean, that'll just completely destroy Novo Nordisk. And I just found it kind of funny that just because they didn't want to pay $250, they didn't continue their patent. Last up, senators push for a ban on drug ads, citing $5 billion in annual pharmaceutical spending. The End Prescription Drug Ads Now Act aims to eliminate direct-to-consumer drug advertising across all media platforms. The bill is spearheaded by Senators Bernie Sanders and Angus King. So it would ban advertising on television, radio, print, and digital platforms. So what do you think? Should pharmaceutical advertising be banned? That's it for this week. See you next week.